Why do patients struggle with their TB treatment regimen? Imagine starting a long journey, knowing it will take many months to reach your destination. That's what TB treatment can feel like for many patients. The reasons they face difficulties are complex and interconnected. First, economic and structural barriers play a huge role. Poverty makes it hard to afford transportation to clinics, especially for those living far from healthcare centers. When money is tight, patients might have to choose between buying food or attending appointments. Food insecurity itself can weaken the body and make it harder to stick with treatment. The long distances to clinics add practical challenges, and over time, these obstacles can seem overwhelming. Social and family factors also influence whether someone completes their treatment. Without family support, patients may feel isolated or lack encouragement. Stigma around TB can cause shame, leading some to hide their illness instead of seeking help. This social shame can prevent them from accessing community support networks. Gender discrimination can further complicate matters, especially for women who might face restrictions at home or social marginalization. The household environment can either help or hinder a patient's ability to prioritize their treatment. The way healthcare services are organized impacts adherence too. When communication between patients and providers is poor, misunderstandings about medication schedules or the importance of treatment can happen. If patients feel disrespected or not valued by healthcare workers, they might lose motivation to continue. Accessibility matters too. While clinics close by make it easier to attend, some patients might develop a false sense of security and neglect their medication, thinking they are cured once they start feeling better. The quality of care and how friendly healthcare staff are can influence whether patients feel supported or discouraged. On a personal level, many patients face challenges like forgetting doses, especially since TB treatment lasts many months. Side effects from the medications can cause discomfort, making patients want to stop. During the initial phase of treatment, patients often start to feel better, which can lead to the mistaken belief that they no longer need to continue. This misunderstanding is dangerous because stopping early can cause the disease to come back stronger or develop resistance to drugs. Lack of knowledge about TB and its treatment also plays a part. If patients don't understand how important it is to finish the full course, they may not prioritize adherence. External factors like the COVID-19 pandemic added new barriers. Fear of catching the virus at clinics made some patients avoid going altogether, even if they could. This shows how outside health crises can disrupt treatment routines and make adherence even harder. When patients do not follow their treatment plan, the consequences are serious. They remain infectious longer, risking spreading TB to others. Incomplete treatment can lead to relapse, treatment failure, and drug-resistant TB, which is much harder and more expensive to treat. Non-adherence also increases the risk of death from TB. That's why addressing these barriers is so important. Effective programs focus on more than just giving medication. They include support like transportation vouchers, food aid, and income assistance. Educating patients about TB and why finishing treatment matters helps build understanding and motivation. Building respectful, trusting relationships between healthcare workers and patients encourages ongoing commitment. Collaboration across sectors can provide the comprehensive support needed to help patients stay on track. Remember, adherence isn't just about willpower. It's about tackling the many obstacles that make completing treatment difficult. Addressing these barriers systematically helps turn the challenge into a manageable journey toward health.